So, what an ordeal I had this morning. My baby hasn't been feeling well, and I delayed taking her to the doctor with everything that is happening. And I was doing the home treatment and monitoring her with her pediatrician. However, this morning we decided to take her to the doctor, and we said, let's try Andrews first because her pediatrician doesn't start working that early. This was like after 5 in the morning. So we went to Andrews. They had a checkpoint where the nurse check your temperature and ask you if you have the symptoms and so forth. So they checked my temperature. I told them the baby has been having a fever, and she checked the baby temperature, tagged my arm with an armband, which means it's okay for you to go in. Gave me an armband for the baby as well, which means it's okay for her to go in, right? They did the same thing with my husband, and we went in. She said I should go to registration. So I went to register the baby and told the receptionist there what was happening. He then said to me, turn your immediate right, then left, and talk to the nurses at that station, which is the nurses station. So I went and I told the nurse that my baby is having a temperature and we would like to see a doctor. The nurse said, hold on, went around the back, spoke with another nurse. The other nurse came and said, we don't see babies under the year of 3 years old. It depends on the situation. So I should go to UE or I should go to children. I'm like, okay then, thank you. No, I'm saying, if you don't see babies under 3 year old, by the way, this is the hospital that I had my baby. My baby is 9 months old. Why didn't the nurse at the front at the checkpoint tell me that? Because she did ask me how old was the baby, and I told her 9 months old. Why shouldn't she tell me that, right? Why, when I went to registration, why didn't the registration person tell me that they don't accept babies under the years of 3 years old? Anyway, I went to children's because that's the next best place at that time of the morning, right? Remember, this is almost 6 o'clock now. Went to children's with my baby. At the gate, they said because of COVID, only one parent can go in. So fine, you know that is me going in with the baby. Went in with the baby. I went to the registration desk and I registered the baby and told the person what was happening, and he said go to the nurse's desk. Went to the nurse's desk and she was dealing with someone, so I was standing because I didn't want to sit based on everything that is happening. So I was standing with the baby, with my bag and the baby bag, right? When the nurse checked her temperature, it was still high. So she said I need to go and get the baby bathed down in some pipe water. And she directed me to the station. She was fine. She assisted me well. She said I had to keep her in the water for 20 minutes, and I did. They gave her some medication. After the 20 minutes, I they had said I should let her air dry and take her back to the nurse's station. So I did. It was a different nurse there, and I went and I told her that I'm finished, and I gave her the paper so she could check to see what the temperature was before and check now to see what it is. She said I needed to wait 15 minutes So I went outside and I was there with my baby, waiting 15 minutes. Waited 20 minutes. Came back inside and I was there and she was doing her thing, doing her thing, doing her thing, and I was there standing in front of her with my baby and she was just there doing her thing casually. Eventually she said, "Come mother, let me test the baby temperature." I went. She did the temperature check. Then she said, "When that patient come out from the doctor, you can go in." I said, "Okay." So I waited until the patient was finished. When she came out, I went in. The doctor said, "Is your baby coughing?" I'm like, "No, she just has a temperature." "Okay, I can't see your baby. I only see babies who are coughing." Yeah, only babies who are coughing. So she said, "Go out under the tent. The doctor is not here as yet, so you can sit out under the tent and wait." Went under the tent, right? When I got under the tent, by this time, this was like minutes to 8, almost 8 o'clock. A whole heap of people under the tent. And I saw a nurse or someone who I thought was a nurse. And I asked her if the doctor is here, what's the procedure, and so forth. She said, "Me don't understand you. When the next nurse come, you ask her." I say, "Okay, fine." Waited for the next nurse to come back and I asked her this. Well, no, I went to the security and I said, "Do you understand what is happening here?" She said, "Yes, just have a seat and wait." Sam said, "Do I need to register out here?" She said, "No, you're good. You register inside so they have your name on the system." I'm like, "Okay." My big problem though, nobody could say what time this doctor was coming. And if it's this is a children's hospital, why is it that there aren't doctors working right throughout? Why do patients have to come and wait for a doctor to come? Nobody can say, "Well, the doctor come in 9, doctor come in 10, doctor come in 11." Nobody can tell you what time the doctor come in. But you and your sick child must just sit and wait. Then we are supposed to be practicing social distancing. There was none of that being happening. None of that. None of that was taking place at children's under that tent. The chairs were as normal, one beside the other. Baby sit down, mother sit down, father sit down, baby sit down, nurse sit down. No form of social distancing. I'm like, I can't stay here with my baby because I don't know what these people have and I'm not going to sit under that tent. So I was standing outside of the tent for a while and then I said, "You know what? This don't make no sense. Might as well me go wait until my pediatrician start work." So I went to the gate and I told the security I was leaving. He said, "No, miss, you can't leave. You need to have a pass." So I went inside and I asked for a pass. She was like, "The doctor needs to give you something before you can get a pass." I'm like, "There's no doctor here." And I was told I need to wait outside until the doctor come. And I told her that I'm not going to wait outside because there's no social distancing being practiced there. And I can't afford for my baby to pick up any virus or for me to pick up any virus. So I am going to go elsewhere. She went to the doctor, which was on the inside, that is only seeing babies with a cough. And I guess she explained what I was saying. Eventually, the doctor gave her a pass, and I left. Listen, our health system is in such a crisis. Like, if you cannot afford private health care, it's sticky, it's rough, bad, 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 bad. It's very sad though. We need to fix this. This cannot continue. This is 2020. We need better health care. Anyway, my baby is still not 100%, but her pediatrician looked at her, diagnosed what was happening. No, she doesn't have corona. We don't have corona. Thanks be to God. right? And she got her medication, and we're back home. But I'm just saying, Andrews, what's your problem? Children's, you need to sort out yourself, especially in this pandemic. It's really sad, really, really sad. I had a rough morning trying to get healthcare in here in Jamaica during this COVID crisis. Like once people hear fever, they automatically think that it's COVID. Like babies get sick all the time, right? Babies pick up infection all the time. It's nothing new, but it's really sad. But I'm happy I got through, right? I'm grateful for that because if I never have no money, it's gonna stick it on me. I'd have to sit down, well not sit down, I'd have to stand up down at children's and wait till when the doctor ready to come before I could get some assistance. So I'm happy that I was able to go elsewhere. Thank God for healthcare. Thank God for his blessings, right? But we country need help. Yeah, we need help bad.